So yesterday was the first time I posted on my Instagram story that I was able to return like 7 different medications to pharmacy, which not that I like haven't been able to do so before, but I just like hadn't gotten around to it. And basically I wanted to talk about medications I take, how hard it was getting pain medications, and just kind of all the different topics on pain medications, opioids, pain treatments, medications they give you, and all that jazz. So basically, when I first got my concussion and I didn't know I had a concussion, and I went in to see my primary, and I just had this terrible pressure headache that I would lay on the floor screaming and crying that would never go away. My dog would literally climb on my face and lick my face as I would scream and cry, and I would count seconds in the day until it was over, and that headache never went away, but it got worse. The only difference is psychologically you learn how to handle it. That same pain that kept you screaming on the floor, you don't scream anymore because psychologically you learn how to handle being in a lot of pain, and your pain has only gotten worse over time. So basically, when I went into my primary, I said, I have this pressure in my head. Is there any medication? Can I get medication? She just said no. So basically, my first year concussion, I was completely not medicated. They did not give me any medications. I had this 24/7 headache that would get worse when I would walk, move, do anything, and they never once offered me any medications. And I just assumed in the beginning that when they said no, that I was just not going to get medications. I guess maybe I could have tried harder. But then by the time my second year of my concussion, I did trigger point injections, and I got those, which would only help with the pain for a couple minutes or two. Then finally I got into a neurologist. Neurologists have a 6-7 month, 8 month waiting list. By the time I got in with a neurologist, the only thing they offered me was antidepressants. So basically, not that just because you're on antidepressants doesn't mean necessarily it's being used to treat depression. They use antidepressants for pain and a lot of different things. So medications I tried was Cymbalta, which I think is called duloxetine too, amitriptyline, nortriptyline. Those medications could not tolerate at all. I forgot to say, once I initially got the nerve pain in my face, when we went in to see a different primary, my mom we went to the appointment, she's like, she has this nerve pain now in her face, this numbness. I called it numbness, but I think more accurately it's better, instead of saying numbness, to say you have pressure in your face, because otherwise numbness isn't taken seriously when what I was feeling was worse than numbness, if that makes sense. And he was like, oh, okay. So he gave me gabapentin, which gabapentin is a basic medication they will give you for nerve pain. And that one was pretty easy to get. But the problem with gabapentin is gabapentin overdose rates are actually surprisingly high. And the reason being is, to manage your pain, you have to climb up and up and up. For example, I babysat for someone whose mom also had trigeminal neuralgia caused by a brain tumor, and what did they give her? They gave her gabapentin, but you would have to be on such a high dose that you'd be so out of it. So for me, I think the highest dose maybe I got up to was 900 milligrams, but the problem was the side effects were so bad that it would cause my gums to bleed, because my mouth would be so dry. I'd be always missing and skipping doses because the gums would be bleeding and it would be so dry. So it was just not something I could honestly safely be on. So I had to make the judgment call to be yeah, I'm in a lot of pain, but I kind of just had to get off this medication because I don't want to destroy my teeth, because that's just not really worth it to me. And at that point, I didn't even know what my true diagnosis was. So I was in the meantime, I don't want to be on medications damaging my body. Then finally, when I got into the regenerative medicine realm, that's when I actually got good medication to treat my pain. Because in that realm, you're not judged for being in pain. It's kind of weird. You almost feel how they make you feel is like guilty for treating your pain. Like, well, do you really need your pain treated that much? You know, your pain is being treated 10%. Do you really need to treat it that extra 20%? When really you shouldn't feel guilty for needing proper pain management. So by the time I got regenerative medicine, you know, I talked to the doctors and I was like, well, because my pain is nerve pain, like I don't respond to other medications and stuff like that. So then they gave me tramadol, which tramadol is a weak opioid, but it's mixed kind of with like an antidepressant too, because so it basically affects like kind of multiple like systems. And that was the only medication out of all the shit medications they gave me that I could actually tolerate. And I like wouldn't give me side effects. I could just take one. I wouldn't have to wait for it to build up in my system, and I would get instant like relief. Like I would say it helps my nerve pain 30%. It helps my neck and like other pain maybe like 60, 70, 80%. But I will say it makes things more bearable. Without my pain medication, it's so hard for me to shower. I can't brush my teeth. Like I would go days without brushing my teeth. And that's how much like pain medication really makes a difference. Because here's the other thing, like you don't win a reward by being in pain. And like that's the other thing, like just because you can survive in pain doesn't mean it has consequences. Because when I'm in more pain, you know, it's like I'm not eating as well. I'm not able to do other things, and all those other things take a toll on your body. So if you have the opportunity to manage your pain as best as you can, it really helps just physically take better care of yourself. So that's kind of like what I like, and I just really like the way like sports medicine, regenerative doctors do it. You know, they're working on fixing your problem, but they're also not going to just let you suffer. Like if you need medication, you need this and that, you're not like judged or made uncomfortable, or they'll refill it. You know, if you need opioids, they'll give you opioids. They will give you what you need, and you don't have to feel like weird about asking.